Well, we have two main procedures that we do for laser vision correction. The original procedure was PRK, which stands for photorefractive keratectomy, and then there was LASIK. Originally, when we did the patients under the first FDA protocol, we were only allowed to do one eye, and we had to wait 6 months to see how the first eye did before we were entitled to apply to perform the second eye. Okay? That lasted for a year or so till we finally saw that there wasn't much difference between doing both eyes at the same time and doing them 6 months apart. So originally that was the question mark, certainly not a question mark anymore. So then the idea was, okay, the patient was under some form of discomfort when they had the PRK, and LASIK came in toward 98, 99, and the purpose of that was decrease the discomfort after the procedure. And yes, it did that. LASIK added a whole new set of issues because we had to have keratomes, microkeratomes, that would create the flap, which went into lasers, which made better, safer flaps, etc. The pendulum has started to swing. Certainly with PRK, there is no flap. The flap wasn't a physiological thing that we were born with any more than a pouch is for a person versus a kangaroo. So there is more discomfort in the first 48 hours with PRK, but you never have to worry about dislodging a flap with trauma or something. And so it's a trade-off. I would say probably the trade-off today is about 1/3 of the people have PRK and 2/3 of the people have LASIK. But again, this is an individual presence, or it's an individual choice of your ophthalmologist. We all have our preferences, but also certain eyes are more amenable to one procedure than the other. So you should have both of them in your armamentarium.